Hello everyone, today I'd like to review another MRI that shows very severe, not just protrusion, but also stenosis in the spine and what's called retrolisthesis, the bones have shifted. Before that, I want to review what normal looks like so you can understand what's abnormal. Looking from the side view of the lumbar spine of the MRI, first thing I'm looking at is the alignment. Is there a curve? That's good. Second is the spinal cord. How's the spinal cord looking inside? Is there a space? Is there a white, which is the spinal fluid? Anything that's white, that's good, which is the spinal fluid on MRI looks white. Second is we're looking at the disc spaces. How are they looking there? Symmetrical. Do they look apart so there's no compression? Another thing I'm looking at is the disc, how the condition of the disc. Are they white? Healthy disc on MRI looks white. Why? Because the disc is 90% fluid. So there's no protrusion, there's no bulging, herniation anywhere in the spine. This is a healthy spine. Here's the abnormal MRI of the lumbar spine. The first thing, does this person have a good curvature? No, it's almost straight. The spinal cord from the top to until the L5 area looks okay. But then if you look at here, look at this, there's no space here. We're looking at the disc itself. All of these discs are black. They're all dehydrated. They're all compressed. What happens is when the disc is dehydrated, they become weak. Any type of compression, whether it's weight or their work, it compresses that. So the gel-like tissue starts to push out and compress the spinal cord. In this case, this person has what's called ligamentum flavum, and the disc from both sides are compressing. Potentially, this can cause severe pain. It could be numbness or tingling down the leg. Another thing that I'm looking at, L5-S1 disc is completely compressed. There's a shift. I would say this is a degree 1 shift from L5 to S1, and also compresses that spinal nerve and spinal cord in that area. So this person, I'm sure, is not a chiropractic case, needs a consultation of an orthopedist or a spinal surgery. Not every case that comes to us that we send them out. I'm just showing you the severe cases that somebody who's not treating it in time to avoid all this stuff. So potentially this person is going to have probably a surgery. So if you like to see what's happening to your MRI, if you want to get a second opinion, I welcome you. Reach out to us. I will personally review your MRI and see if we can avoid that surgery or any type of spinal injections.